Hi there, and welcome to Top Dog Tips' YouTube channel. Today we're going to be talking about why your dog's stomach may be hard and what to do. Before we begin, please like and subscribe to our YouTube channel. Please be sure to also subscribe to our website, topdogtips.com. If you click the link in the description below, you will receive a free ebook that covers 25 vet-recommended homemade dog food recipes. All right, without further ado, let's get into it. 4 reasons why your dog's stomach is hard and what to do. Now, when your dog's stomach swells or hardens, there may be a serious cause for concern, or it just may be a case of your dog overheating. It's important to know the difference between something that can take care of itself versus something that can cause your dog serious harm. Now, the 4 main reasons why your dog's stomach might be hard are gastric dilation volvulus, GDV, peritonitis, Cushing syndrome, and ascites. Of course, there may be a few other reasons, but these are the most likely ones. By knowing the symptoms of stomach problems in your dog, you'll know what to do in the event of something more serious happening. So let's get into the first one. Gastric dilation volvulus, or GDV for short, is very dangerous and it's a form of dog bloating. It's often called the mother of all emergencies because if left untreated, your dog could die within hours. A dog's stomach may stretch or bloat because of food digestion or gas, but GDV occurs if the bloated stomach rotates. Now, the rotating of the stomach will trap the gas in the stomach and cause the blood supply to the stomach to become blocked. Your dog will be in extreme pain if GDV happens. Now, some symptoms to look out for GDV or bloating include a hard abdomen, a distended abdomen, bloated abdomen, vomiting without apparent cause. Your dog is restless, they're salivating excessively, they are breathing fast and heavy, or it looks like they're struggling to breathe, or if they're standing with their neck extended and elbows outward. If you check their pulse and it's a rapid pulse, a rapid heartbeat, as well as pale mucous membranes, or if they collapse. Now, to treat GDV, you need to get your dog to a vet as soon as possible. This condition requires the stomach to be decompressed. Once the gas has been released from the dog's stomach and their heart is stable, surgery is typically the next step to correct the problem. Unfortunately, there is no hard evidence on why this happens, but there are things that can and will increase your dog's risk of getting it. For example, when a dog eats fast, if your dog only has one larger meal per day or uses a lifted food or water bowl, the risk of GDV actually increases. Other factors for GDV include the dog's breed, their weight, the dog's age, and the dog's family history. Now, dog breeds with deep chests or dogs who weigh over 100 pounds have a 12% higher risk of bloating. Older dogs between 7 and 12 years of age are also at an increased risk. Finally, if a dog has a family history of bloating or GDV, they are at greater risk too. Now, to help prevent canine bloat in your dog, make sure they are eating 2 small meals a day instead of 1 large one or normally portioned meals. Do not use the dog food that causes your dog to have excessive gas, and allow them time to digest their food after eating before they go play or exercise. Now, number 2 on the list is peritonitis. It's a serious infection that can cause a rupture or puncture in your dog's stomach. The rupture or puncturing is a result usually of ulcers or tumors or even splinters from those bones that they eat and chew on, along with other reasons. Now, the symptoms they'll have would be severe pain, or shouldn't be hard to tell. I know they can't really tell us that they're in pain, but make sure you watch their behavior, and if it looks like they're in pain, I would take note. Vomiting, as well as a swollen or hard abdomen. Because of the severity of peritonitis, the dog may be unwilling to move or go into shock. The treatment for peritonitis includes surgery to repair the rupture or the removal of the infection with IV fluids and medication, meaning you'll definitely need to take your dog to the veterinarian. This is an urgent matter. It's not something that you should try to handle on your own. To help prevent the potential for a stomach rupture or puncture, do not feed your dog's bones. And if you still do, just watch them as they chew on it. I know my dog, when she chews on something that's typically hard, if it gets to the point to where it's small enough that they could swallow it and sharp enough, that's kind of when I take it away from them, or at least give them something else. Number 3 is Cushing's syndrome. Cushing syndrome, or hyperadrenocorticism, is caused by the excessive production of cortisol, like the hormone in humans. In addition to a hardened stomach or potbelly look, your dog also may exhibit other symptoms, including excessive eating, they're drinking a lot, they need to urinate quite frequently, abnormal panting, as well as loss of hair. The cortisol hormone may be overproduced in the pituitary gland, which is the most common cause of Cushing syndrome, or there may be an adrenal gland tumor, which is less common. Now, treating Cushing syndrome is usually taken care of by a new form of medication. The new medication can help to treat both types of Cushing's syndrome. If the dog has the second type of Cushing syndrome, the less likely form, surgery may also be an option to remove the adrenal gland tumor. Number 4 on the list, ascites. Ascites happens when there is a buildup of fluid in the dog's abdomen. This type of buildup leads to swelling in the dog's abdominal region, and then the fluid can be the result of many different things, including but not limited to intestinal disease, liver disease, kidney disease, or heart failure. Now, because there is such a wide range of conditions that cause ascites, there's an equally wide variety of treatments. Now, the treatments will depend on the specific diagnosis given by the veterinarian when you take your dog to the vet. Now, there are other causes as well as these 4 that can cause your dog's stomach to swell or harden, like excessive gas from the dog eating all of its food too quickly, a injury that results in internal bleeding, or a blockage in the stomach or intestines or tumors. Now, in young dogs, roundworm infections can also cause the abdomen to swell. Treatments for these also vary based on the severity of the issue. Now, if your dog's stomach becomes hard, swollen, or distended, and it is not because they ate their food too quickly, they definitely should be taken to a vet as quickly as possible. Veterinarians will diagnose the problem, and by completing like a physical exam and doing blood tests, as well as a urinalysis or x-rays. Now, by supporting your dog's overall health, you can help prevent some of these stomach problems. The best way to support their health is to take them in for annual checkups, so you can make sure that your vet will give you the thumbs up that their vital organs are in good health. Well, that will wrap it up here for us at Top Dog Tips. Be sure to like and subscribe our channel, and thanks for tuning in, and we'll talk to you soon.